Okay. In this video, we'll be doing the IM injection. We have our 3 milliliter syringe. We have our medicine, which is going to be morphine. We have our cotton ball. We have our MAR, and we have our alcohol prep. There are 5 sites for this injection. You got your deltoid, your ventrogluteal, your dorsogluteal, your vastus lateralis, and your rectal femoris. Before you do any of your preparation, you want to check for allergies with MAR, and you'll also perform hand hygiene before starting anything. And you also want to check with the other documents. You want to check the time and location of the last dose that was given, so you do not give it too early or too late. For this one, our scenario, we were given morphine 7.5 milligrams IM as needed, post-surgical pain. It's got 5 milligrams per milliliter in our bottle. Let's see, where's there it is. Okay, so we're gonna go ahead and while this is we're gonna wipe this for 30 seconds and make sure it's clean and let it dry while we do our calculations. So what we're gonna do, we're gonna put 7.5 milligrams over 1 milliliter over 5 milligrams. So what we're going to do is we're going to divide 7.5 divided by 5, and we're going to get 1.5 milliliters. Okay, before we start, we are going to check our medicine bottle 3 times. We're going to check it whenever we're getting it out of the cart. We're going to check it after preparation. We're going to check it when we're putting it back. We're going to check for the expiration date, any floaties, any cloudiness, anything that could harm our patient. So what we're going to do right now is we're going to go ahead and draw back to 1.5 milliliters. Okay. We're going to remove this. I'm going to go ahead and put our air in here. We're going to turn it over and draw back 1.5. Okay. Got 1.5. Alright. And we're going to recap it. Okay. Now we're ready to go to our patient's room. We're going to, let's see. We're going to go to the patient's room. We're going to introduce ourselves. We're going to identify the patient. We're going to ask them to state their name, their date of birth, and we're going to scan their ID bracelet to make sure that we have the right patient. We're also going to recheck for allergies. We're going to perform hand hygiene. We're going to put on gloves. Okay. We're going to go ahead and wipe our injection site from inner to outer in a circular motion. Let that dry. And to avoid putting any liquid into my fake skin, I'm also going to insert this back into my container. And reinsert it. And I'm going to do an example with air instead. Okay, we're going to draw back to 1.5. Okay. Alright, what we're going to do for the injection site, we are going to spread the skin, make sure it's firm. We're going to do this at a 90-degree angle, okay? And we're going to stick the patient, grab, we're going to aspirate just a little bit. We're going to give the injection. We're going to remove Sharps container. And we're going to hold a cotton ball on it if there's any blood. Okay? I'm just going to wipe it. Alright, and after that, we're going to make sure that we put them in a comfortable position, wherever they're comfortable. We're going to remove our gloves, perform hand hygiene again, and document the time that we gave the medication, which patient we gave it to, how much we gave it, and make sure we have everything compared to our MAR, and we should be good.